Hello, this is my first solo video as Doc Mick stiffens, and I have been encouraged to introduce myself in some respect so that you guys out there know a little bit about me and why you're listening to me next to Leia when we do our heart-to-hearts and hopefully keep collaborating into the future. My name is Lea Khan, and I think in this little intro video, I'm going to keep it short. I'm going to start with an anecdote because I think it might give comfort to those people who are or who have been hurt by the medical process in the past, hurt by other people not believing us, sort of a little story that like kind of wraps it all up. So I suffered with pain my whole life. I think, 10 years old, my parents took me to see a chiropractor, friend of the family, brilliant guy. He said I had hyperlordosis, to sleep on my back, which I've done since I was 10 because of him. And so he took a young girl seriously. My parents took me seriously. So I think that it was, still say like late 80s. I think if it had been now, I might have been diagnosed even had it gone further with pediatric case. But I did suffer with lots of pain. But it didn't and you stopped me in my tracks until 30 about, and actually dead on 30, age 30. And so this is the story. I was a attending physician at Yale, also doing a clinical fellowship, and I was feeling that the pain in my muscles was getting worse, and I wasn't able to, concentrate as well as I was used to. I wasn't able to work the long hours that my position demanded of me, or that I demanded of myself in that position, to honor it. I was pushing and pushing, not really seeing myself as I would see my patients, as a whole person. That's not just their job, but that's suffering. I was lucky enough to have a colleague, my co-fellow, who was with me and saw me and observed me, and he said, "This isn't normal. You need to see a neurologist." And as two psychiatrists talking, it was sort of a funny conversation. And I'm looking at this MD, PhD, brilliant man that I respect telling me, "This isn't normal. Get it checked." And I tried, and he even had to make that final call that got me a neuro appointment, because I know we all suffer and struggle with getting appointments, getting into clinics. You're not alone. I was a physician. I was on staff. I still went through the same wait times and calling different places and just trying to get somebody to take me seriously. And I thank goodness for this person, and he got me an appointment, and I saw my doctor, who validated sort of what I was thinking, was able to, kind of say things back, process with me a little bit. And it sort of started becoming clear to me, because we study stiff person syndrome for the psych boards, so you have to know about it. And it was all coming clear, my whole life flashing before my eyes, that, wow, this does sound like stiff person syndrome. And even though that it was still, so that was a defining moment. But from there, there was trials and tribulations, and one came the only time I allowed my anybody to take me to the emergency department. Was I was twisted up, writhing around. If you have SPS, you'll know why I was doing that. if you're in such pain and it's everywhere and the muscles of your core, your abs, and your back are contracting at the same time, SPS is a unique condition muscularly because agonist and antagonist muscles can both be rigid at the same time. That's not supposed to happen in normal physiology, normal biology. So it's a very bad thing. That's why if we're in bed and we have a fever or some other escalating thing like that factor, we can break bones in bed. I've dislocated my shoulder in bed. It's self-dislocated. Um, and then I hope you can hear me. I self put it back. Thank you, training at a level 1 trauma center where we relocated a lot of joints. Also, the chief resident of the orthopedic staff was an old friend of my sister and they're all metalheads, and my brother-in-law's Carrie King from Slayers. That did not hurt my training in orthopedics during my surgery rotation. My shoulder came out, I had a fever, I put it back in, I shoved ice on it, laid on my kitchen floor until I woke up. It wasn't ideal. I don't recommend that. That was something that happened to me. And so as I stray, but I think it's important, it's just another gruesome tidbit to sprinkle in sort of what we go through and how serious it is. So now we're going, from that shoulder, now we're fast forwarding years back, and my mom said, I am taking you to the emergency department. And I thought, well, people know me now. I'm in the chart. I'm known in the community as a treater, so this, okay, maybe that makes sense. And I was met with the physician there was a fellow, and I remember her name. I was so miserable and so overcome with the pain that I couldn't even give a proper history. I couldn't sit still for a blood pressure and she was just not engaging. She wasn't examining me. She wasn't making any attempts to get any information out of me. So my mom, being very assertive and very just on it, told her a succinct version of my story. I'm in the, check me out. I've been seen already in neurology, blah, blah, blah. She's a physician herself. She works here, blah. Nothing could make this doctor change that look in her eye, that thought. And of course, I happened to be in I love this skirt, Free People gypsy skirt, and a t-shirt, and I looked like, I wasn't in my try to look older, menswear red lipstick look. I was looking, in flip-flops and maybe, a little bit, casual and a little bit of a mess, like young, a mess, and I'm twisting around and maybe, so I knew what that would look like in this time in the U.S. When we're going through a opiate epidemic that is so severe. I know it will because clinically I worked in addiction for many years. So much of my choices when we had them were to do addiction work, and then all the way up through my clinical specialty, I preferred anything addiction. So this is it's kind of my thing. And so she looked at me, ignored everything we were saying, ignored my presentation, and just said with these dead eyes, well, I can give you a fix. Like as if she would really just give me, I don't know what a fix meant to her, but maybe I don't know, a Vicodin and send me on my way. And I was so confused, but I was still in that state where I couldn't advocate for myself. So my mother was, doing the talking, and thank goodness she was. And she's like, she wouldn't, come to the place she's known to get a fix if that's what we're going for. It was ridiculous, beyond ridiculous. And I hope that that person, I think she was ID, she was an infectious disease fellow at the time, and I hope she knows that she took a piece of my soul that day. When she looked at me with that deadpan look, she commented on my new engagement ring. I was newly engaged and newly, having these problems. And she was horrible, commenting on giving me a superficial compliment while not treating me. And I'll wrap this up because it's getting long even. It was supposed to be a short anecdote, but it's an important anecdote because no matter who you are, who you know, how good of a person of a soldier you've been and done the right thing, the right steps, it is still a battle. It is still a war to get seen, to get heard, and then to get treated. So don't feel bad, because I went finally saying, okay, I'm going to let you take me to the ER because I have no other choice. And we were discharged into the street with no plan. And as a psychiatrist, if I suspected that a patient presenting did have a withdrawal syndrome from a drug, I would want to ask their consent for a urine toxicology. I would want to talk to them about possibly substance use. I would want to, if I found there was substance abuse, I would want to talk about rehab and detox, and there was none of that. There was none of that. There was no vitals. So and the discharge plan was kicking us into the street. Thank goodness we went from there right to another ED, and it was still hard there, but I got treated. So it's not easy, and so I hope that this little introduction gives you a sense of who I am. Somebody who wants to be super understanding and respectful, because I've been in it, and I'm sure I've hurt people as a physician that if I knew about it, I'd probably never sleep again. So I don't want to minimize the stress that physicians are under right now, so that the mistakes that we make should be taken a little bit, give us a little birth, but I think that I'm telling this story in my intro video because it shows the two sides of me, and that was the beginning of my almost now decade of having to process the two sides of me, the doctor and the patient. And that sounds crazy, but I was a doctor that was only a doctor. That's my thing. That's who I am. It's not what I do. It's who I am. It is still, it always will be. It's just who I am. I'm a fourth generation physician. I feel it runs through my blood. I feel it. And that sounds crazy to some people. It always has. I've thought it my whole life and heard it my whole life. And but I want to say it that way because I think that instead of hiding as I was, because I thought you can't be a physician and talk about a disease like this, a 1 in a million disease that depends on studies with investigational treatments, and talk to the public, because you're going to be put in a spot where you have to start talking about, well, what are you on? And this isn't in any way, Doc McStiffins isn't in any way intending to be your physician, but just your friend who happens to be one. And I don't think it makes me weaker anymore. I think it makes me stronger as a person who can help others that are on the journey of processing this, and this being stiff person syndrome. But I also want to include my friends out there that are suffering with other neuromuscular conditions, because they're all brutal. And so just very much love to all the people that have given it back to us when we're just trying something out. And I really do appreciate people listening, watching, wanting more content. We want to improve for you guys. We want to show up for you guys. That's giving us like purpose in this cool new way. And and it's gonna be different for everybody. And I didn't have this outlet, heart to heart with Leia, and I wasn't on, I'm shied away from social media again for almost 10 years after, I'd say, just pre-diagnosis. And so, like, right pre-diagnosis. So let's say it took me 8, 9 years to get here. So don't let it take you 9 years to get here. Be who you are, what you are, and have this condition. It's all the same. It's you. And so you don't be fake, don't be phony, don't act up for your doctors, don't minimize, don't think you're taking up too much time in the medical part, because you're a 1 in 1,000,000. So you can, you can really give it your all. They'll understand why, I think. And I just hope that this gives a little bit of hope, that I know the horror stories are out there and they can stop us. And at that moment, if I didn't have the supports that I did, really direct doctor supports, like the thing I needed, the thing everyone needs that has a condition that needs to be diagnosed, I had. So I was so lucky. And that's what got me into treatment, but it was still a battle. And that little story I told, getting kicked into the street, not getting the respected steps of my own clinical dealings, like, it was traumatizing. And I know that sounds ridiculous, and I have treated people with real trauma, and so I know I'm being hyperbolic when I use that word, but I didn't know what I was going to talk about today in this intro video, but this is what comes. So obviously, I'm not over it. So it did get in my brain. It got lodged in because so much emotion was attached to that moment. And that doctor and the way she treated me will never leave me. I wanted it to make me a better physician. In that moment, I said, "Oh my, please let me never look at somebody with dead, disbelieving eyes." I mean, I'm being generous with disbelieving. That's a feeling. I didn't see that. So I never wanted to be a zombie doctor, and I hope I never have. Even if I've been wrong, I've not maybe been a zombie because of that lesson. And, even after 36 hours up and on my feet, the pager goes off and you snap to, because that's the job. And I felt, forget professional courtesy. I think that went out in the 80s. There's not much of that going on. In fact, you find a lot of people pulling back from you. That's why I think it was so hard for me to wrestle those things of, like, how am I gonna, people are saying, get out there, be on social media, talk to other people, because you have this interesting perspective of having treated patients with neurological pain conditions, and having one. And I couldn't see where that would work, and now I do. So this is it. This is me. And I hope that you guys find whatever we and I do going forward helpful. So peace out. And I know that you'll come in with your comments and questions. And I look forward.